I also want to talk about today the coronavirus truth in numbers. You know, we continue in this country in states at various stages of shutdown, aren't allowed to leave your house, only essential stores open, only essential things you're allowed to buy when you're in certain stores. Businesses can't open. You know, the economy has collapsed. Unemployment numbers. In fact, I had a guest on last week on the show. I think it was Chip Roy, but one of the guests was talking about the idea that we lost more jobs. We lost more jobs in the past 8 weeks, meaning unemployment filed, than we gained in the entire upsurge, entire improvement of our economy, not just under President Trump, but even if you count before President Trump and the economy a little bit turning around, we've lost that many jobs in 8 weeks. And so I want to give you some, and it's all the threat of the coronavirus. I know we've been on this show many times talking about in fact, I urge you, if you haven't read about it, to be sure and read about and understand what the left did what the Washington, D.C. establishment did when they got really bad numbers out of London, out of a doctor named Neil Ferguson in London. Another source actually in America, out of the University of Washington source, also gave very bad information to Washington. And so they had death projections, lethality projections, infection rate projections, projections related to the number of ICU beds needed, hospital units, all sorts of things, grotesquely exaggerated. And so we jumped in, this is now in early March, we jumped into an emergency state unseen in American history to respond to the coronavirus because of really bad data and really bad models. I want to share a bunch of data with you in just a moment to inspire you to think we are still reacting to the bad data. We're still taking action, keeping our economy shut down based on bad data. It's like one analogy I used in some speech I gave was the idea that if you took a patient's temperature and their temperature you thought was 109 degrees, you would drop everything you're doing. You would turn all of your medical attention to do everything conceivable to revive that patient, to bring down the fever, to make sure that they survive, because it's very dangerous to have a fever that high. But the moment you realize that the thermometer was broken and the person's temperature was really only 99, you would drop the emergency reaction because you have better facts. The person's temperature is only 99. In the same way, in this country, we are still in emergency response mode based on bad data that's now long proven to be inaccurate. I'm going to start. There's one little clip, it's not even a clip. It's a graph to show you. I sent to Matt, the wonderful producer, who has just been, I want to thank him, is extraordinary, doing these shows from home, so helpful, so on top of things. I want to ask Matt to show you this particular picture. Okay, that is a map of the United States of America. You can see up in the New England area, a tiny little area that is red. In the New England area, New York obviously included. So what this map is showing you is dividing the number of coronavirus deaths in this country by geography. So that tiny little red area in New York and surrounding areas, 1/3 of all the coronavirus deaths in this country happened in that red area. The yellow area only slightly larger around it. You see the yellow area only slightly larger around the red. 1/3 of all coronavirus deaths happened in that yellow area. So 1/3 in the red, 1/3 in the yellow. The entire United States, the whole rest of the country includes, as you can see, Alaska and Hawaii at the bottom, entire US mainland. The remaining 1/3 of all coronavirus deaths happened in that area. My point is, we had a drastic and horrific problem in a very tiny portion of America, and yet nearly the entire country remained shut down. So that's the first bit of data I want to share with you. Mountains of data today, but really simple things to follow, all to make the point we do not have to continue under this economy crushing, free market crushing, leftist empowering shutdown because the data do not justify it. So here we go. I want these, and I also want to be sure and tell you some more about Wuhan in a moment. But I first want to tell you that the CDC is now acknowledging that U.S. COVID-19 deaths peaked in mid-April. We are now in early May. So we're on the downside. US COVID-19 deaths peaked in mid-April. It's also true in America. The data that you just have to understand, half of all deaths in America, half of all coronavirus deaths happened in just 5 states. New York, New Jersey, Pennsylvania, Massachusetts, and Michigan. The majority of those have occurred, the vast majority, even those occurred in New York State. The CDC has acknowledged, Center for Disease Control has acknowledged, 90% of all virus hospitalizations are of people who had serious pre-existing conditions. It's not striking down healthy people. I'm not saying that there's not a healthy person in America who has not most unfortunately contracted and even succumbed to COVID-19. But the crisis nature of what we are doing is not justified by the facts on the ground. 86%, as an example, of Illinois' 3,000 plus deaths were in ages over 60. You can just, I can go on and on and on with data, but to make the point that we have people who are threatened by the virus because of age or pre-existing conditions. We have the vast majority of Americans who are not threatened, but everyone's life is being shut down. Everyone's life is being shut down. I also want to make a point about numbers in this segment related to coronavirus. There was a great piece comparing the state of Georgia with the state of California. Now, yes, and the piece I'm referring you to, and you can read it at my website, americacanwetalk.org, on the homepage under shows, drop down list of links. In Georgia, the governor there, Governor Kemp, decided that in the final third of April, essentially, that he was going to open up the state. It's been open 20 days. And so he's opened up the state, and they're keeping track of what they're doing. They're doing all sorts of careful opening, contrasted with California, that is continuing a massive lockdown. California is still in massive lockdown. Everything's closed. You can't leave. They've opened some beaches, but then they are closing them again if people get too close to each other. But I want to tell you, and again, this data matter because it helps you realize that policy in this country is not being driven by science, is not being driven by data. In the great state of Georgia, as they have pursued their opening of the state since April, they now have the lowest number of COVID-19 patients hospitalized in the whole state, based on compare with when they started this whole effort. So they have the lowest number of COVID-19 patients hospitalized, lowest number of ventilators in use, under 1,000, the whole state of Georgia. 11,000 people tested in the last 11 days. Testing available for 110,000 people were tested in the last 11 days. Testing is available for everyone, and they have a declining percentage of Georgians testing positive. So they're in the downward trend in all good ways. Contrasted with California, continues its lockdown, and they are trending up. They're one of the few states where the numbers are even worse than the projections that were originally made. Shutting people in place is not preventing the virus, is not preventing the virus from spreading. California shuts them in place. Virus is worse than the predictions. And the other thing, just to mention to you, I think you probably saw or read about this, but in the state of New York, they have recently announced that 2/3 of the new people newly admitted to the hospital, 2/3 of their new coronavirus patients, COVID-19 patients admitted to the hospital, came to them from lockdown. They're coming from places and from people who are on lockdown. So the lockdown is not preventing people from contrasting the virus. These are really, really, really important points to understand. Also, in addition, in the data we talked about originally that came out of England, and you had Neil Ferguson of Imperial College, who has now, I announced last week, but in case you missed a show that day, Neil Ferguson is the one who originally created this monstrosity of a model projecting massive death, massive infection rates, horrible outcomes, all from the coronavirus. He projected those, And they were by orders of magnitude wrong. They were the numbers that now Doctors Fauci and Birx have admitted they had in their heads, they had in their hands when they went into President Trump and told him that unless he locked down a country, we'd have between 1.5 and 2.2 million deaths. That's the number they were relying on. Neil Ferguson now, having put these horrific projections out all over the world, all these countries panicked in reaction to it, did shut down. Neil Ferguson had to resign from Imperial College recently for violating the violating the quarantine that was put in place because of his models, and he violated that quarantine because he was sneaking off to meet with his married lover. So leaving that aside, other actual experts have now done a deep dive into what Neil Ferguson came up with. And I'll just share with you. There were quite a few just pretty damning comments made by actual experts who looked at what he'd done, and their expressions were, and looking at the code he used, the kind of the model for the model, the code he used was deeply riddled with bugs. Huge blocks of code, bad practice, quite possibly the worst production code I've ever seen. That was all related to numbers. We do need to care about our fellow neighbors and friends. We do need to have protection of the vulnerable. We need to make sure the hospitals have what they need to care for patients, and doctors do. We have to be careful to protect and help people. But we do not have to continue a shutdown that is destroying the American economy, much to the glee and joy of the left, but is also not necessary in response to the actual virus numbers. I want to tell you two more things in this segment before I turn to my next segment about the reaction, science or a plot. But, all of this kind of came to America's attention in January, and people in America became aware that they had a big problem in Wuhan, in China. And in Wuhan, they had this outbreak, and they had, this concern about, did the virus come from the wet markets? Did it come from the bioweapons lab? And, both people who have either opinion, there are very arrogant people who have a view in both opinions and mock the other side for not agreeing with whatever they say. Whatever it came from, and we will get to the bottom of it as Americans, we also now know that because they monitor so much about China, thank goodness we monitor so much about China, we now have a report obtained by the London-based NBC News verification unit that there was a cell phone, because they monitor and access cell phone usage data. There was no cell phone activity at all in a high security portion of the Wuhan Institute of Virology from October 7th to October 24th. 17 days, no cell phone activity. It was a blip on their screen because it was inconsistent with its usual. And so they're assuming there was a hazardous event, apparently, in the Wuhan lab as early as October. We also had information from the German intelligence that basically picked up a call between the head of the World Health Organization, WHO, and the Chinese president, Xi Jinping, where Xi Jinping is asking WHO to hold back information about the coronavirus, about person-to-person transmission, and to delay a pandemic warning. So we have all sorts of bad information, bad actors in China, and here we are in America, we're still on shutdown.